I was driving home at 3 in the afternoon and I fell asleep at the wheel. And when I woke up, I was in a ditch, and by God's grace, I was not injured. I was able to make it home, but just barely. I kept falling asleep on the way home. You would think something like that would scare you so badly that you wouldn't be able to sleep for a couple of days, but within 100 yards of leaving the scene where I'd left the roadway, I was falling asleep again. And at that point, I knew, adding everything else together, the constant fatigue, the never feeling rested, I needed to go see a specialist.
What frightened John was that he could have died in the accident. And his wife and all his loved ones would have prematurely lost him. That was really what frightened John. He wasn't sure what caused him to fall asleep at the wheel. Neither did he know the connection between his snoring and the fatigue that he felt and how tired he was. Neither did he know that his blood pressure was coming from sleep apnea. Sleep apnea raises blood pressure for almost 15 to 20 years during sleep, in your sleep, before blood pressure becomes evident in the daytime. So in case of John, he's probably had sleep apnea and elevations in blood pressure during sleep even when he was 5 or 8 years old.
When he called me to come back in, I was very surprised when he said, "John, you have severe sleep apnea." I don't know what I thought he was going to say, but I guess I thought he was going to say, "There's nothing wrong with you," because that's what I wanted to hear. But what I heard was, "You have severe sleep apnea." But the good news is, we can treat it and we can manage it, and your whole world is going to be different.
Of course, John is one of the model patients. John has done wonderfully with CPAP therapy. He has taken the treatment like a fish takes to water. And of course, he has seen the benefit of it. He has not had problems with those attacks of sleepiness as bad as he used to have them. He has noticed the improvement in his energy level as a consequence of using his CPAP machine. And there are so many other objective elements in his diagnosis and medical conditions that tells me that he's doing so much better with the CPAP. But he has stuck with the treatment all through the time that I have seen him. And now that's almost 6, 7 years that we have treated John. And he has done very well with the CPAP.
I hope that my story is the story that changes someone else's life. So I would say to anyone who thinks that they have a sleep problem, who knows that they have a sleep problem, whose wife or husband is telling them, "I can't sleep in the same room with you anymore because of your snoring," go seek treatment, because I'm here to tell you from experience, it will change your life and you will never want to go back to where you used to be. You just won't.